First and foremost, the lecture is meant to educate you guys on what we're capable of doing here, what we offer here, and the technology behind what stem cells are. So let's get started. So we'll start off with a couple questions for you guys. How many of you have heard of the miracle of stem cells? All right, good. Have you heard it outside of here? Have you heard it here? Or have you heard it from your own research? Gotcha. Has anyone had any stem cells done? The placenta, okay. Anybody else? We have Dr. Gurman, was our guinea pig. So there's usually two reasons why people come to our lecture. One is to learn about stem cells. The other reason is to find out what stem cells are and whether or not they're suitable for you. And that's really what I'm going to get into with the lecture. So it's a new life, and that's basically what the running theme is with stem cells, is they really give you a new life. It's a treatment option that is now available. It's an additional treatment option that we have that's now available that provides your joints, your muscles, your aches and pains with a new life. Unique and not like any other treatments that's currently out there. So we were built to move. We live in New York City. New York City is a hustle and bustle city, so everybody's built to move. We don't want to sit around. We don't want to not be able to move. You know, we don't want our body to limit us to move. And this is why stem cells is a great treatment option. So, and when we don't move and we sit still, we develop bigger issues. And these issues are diseases like diabetes, high cholesterol, obesity. And those are a lot tougher to deal with than knee pain. Diabetes. Yeah, it's just an abbreviation for diabetes. So what's our purpose? Here at Physio Logic, our mission is to help as many people as possible. And we do this in a variety of ways. We're an integrative practice, so we utilize chiropractic treatment, acupuncture treatment, physical therapy, nutrition, functional medicine, just to name a few. And now we're adding stem cell therapy. So our mission here is not to mask the symptoms. We don't want to just mask your knee pain, your shoulder pain, your muscle aches that are preventing you in your everyday life. We want you to get out of that pain cycle. We want you to regain your health back. We want to maximize the rest of your health for the rest of your life. And helping you achieve this is why I went into interventional spine and sports, why I chose physical medicine and rehabilitation, because that's what we do as a specialty. We help people regain their function from things like strokes, and now when I subspecialize in any spine or sports-related diseases. So we want to promote the possibility of repair and restoration. And again, this is another running theme that we're going to have here, is stem cells repair and restore your body. We're not masking any of the symptoms. We're not leaving it to chance. We want to see if we can regenerate those areas that have been degenerated. And basically, we want you to do, and what does that mean? We want you to do what you want to do, if it's gardening, if it's running a marathon, if it's being able to ride a bike, if it's carrying your grandchildren. That's what we want you to do. So some quick facts about stem cells. So they've actually been around for over 20 years, predominantly used by plastic surgeons in their wound healing properties. And now more and more subspecialties are using them or experimenting with them. And sports and spine doctors are lucky enough to have easy access to utilizing them and the research behind it that supports it. So it was first popular in Europe, mainly Germany. A lot of athletes were actually flying out there to get these procedures done to them. They were very expensive back then as well, so only the elite with money or fame were able to get them. And now it's becoming more and more popular in the United States. And with anything in medicine, as it should be, it takes time. before it becomes the mainstay of treatment. So there's due diligence behind the treatments before it becomes widely accepted by every doctor. So that's why there's a slow gaining popularity in the United States. So again, stem cells restore and repair. So stem cells are essentially your body's master cells because they develop into any other type of cell that we want it to. And I'll get more into detail about this, but I just want to give you a little introduction about what stem cells are. So what they become is new cells, and that's how they restore and repair the damaged tissue or joints in your body. And stem cells can become cartilage, they can become ligaments, they become bone, they become brain cells, blood cells. Anywhere you put the stem cells, they'll mimic that type of environment and grow into that type of cell. And that's the simple science behind it. So stem cells are different than what's offered now, and yet another tool to help us restore and repair your body. And again, they're different because they're helping you restore and repair the damaged tissues. So I'm just going to drive this home over and over again. So they're not like any other treatment. They have the potential to help take a degenerated area and regenerate it. And they're safe, whether they come from your blood, bone marrow, or amniotic fluid. And those are the three ways that we actually extract the biologic agents or stem cells. So here's a simple diagram, and I'm just going to explain briefly how it works. So on the right over here, you have a healthy knee joint. So you see the white grayish area, that's the cartilage in the knee. So with time, we always hear arthritis. Arthritis tends to settle in. And that can be in any age group. It doesn't have to be as you get older, it could be younger. The more active you are, the more wear and tear your body takes. So essentially what happens is you'll get breakdown in the cartilage like you see here, and then the bones don't look nice and fluid as they do on this side. So what stem cells do is that there's a potential when injecting the stem cells into the degenerated area that it's going to restore and attach into these broken down pieces of cartilage and bone and help your body restore and repair them, so then you can start looking like a healthy joint again and have no more pain and more function. And that's why stem cells give a new life. So again, they don't just mask your symptoms. They heal the underlying cause of your problem, just like I explained before in the previous slide. They get to the root of it, repair it, and bring new life to it. So unfortunately, when your body starts to degenerate, the process just continues on until you stop it. So the only way that we can really stop this is by repairing and restoring it. And stem cells offer that option now. So the question is why wait until your body breaks down? So you can do this as early as possible or as late as possible, and that's the benefits of having it available for you. So you don't have to wait until your body starts the degenerative process. You can start it early, at a young age or at later on in life. And again, we want to keep you moving, so now your body needs to keep up with it. And that's the general problem. Science and medicine has become so good in keeping us living a lot longer. Now we want you to be able to move with your body as you get older. So stem cells' promise in medical treatment is that they can become any cell, like I mentioned before. They have the potential to repair, restore, replace, and regenerate any cell in the adult body. They work especially well in degenerative joints, muscles, tendon tears, areas like the shoulders, the knees, the back, the neck, and the hips, just to name a few. All right, we're gonna switch gears a little bit and we're just gonna bring the attention over to you guys. So when you guys walked in, you were handed a survey. So I'm gonna ask you guys to take out that survey and we're gonna fill it out together. If you guys already filled it out, that's fine. We'll just go over it real quick. All right, so the first question is, which following area of your body bothers you the most? Or which following area of the body bothers you? So you can click off one, you can click off as many as you want. Your knee, both knees, your neck, your back, your elbow, your ankle, your hip. And then what I want you to do after that is think about which one of those body parts bothers you the most. And then you can fill out the remaining questions underneath there. On a scale of 1 to 10, based on that body part, how bad is it? When is it worse? What makes it better? How often do you experience it? And now when you think about those body parts, or that specific body part that bothers you the most, how does it make you suffer? Are you moody because of it? Do you have a poor attitude? Are you not able to do certain activities? And then finally, the last question is, does this affect your life? Do people recognize that you're a moody person? Does it hinder your ability to exercise? Is everybody caught up? Good? Okay. All right, so let's get back to the science a little bit. What I'm going to do is just go through a couple slides to show you what that word arthritis, what it really means, that you've all heard of before in the past, or you might even experience, or maybe your medical doctor has told you that you have arthritis. So we're going to use the knee again as an example. So right here we have an x-ray of the knee. So this is the long bone in your thigh, this is your shin bone, and we're going to focus on the actual spacing within the knee. If you guys can imagine, you see the space in between this area. It's a little bit wider than the space in this area. And that's early signs of arthritis. And that's really what arthritis means. It's wear and tear in your body where the joints are narrowed and the space in between them are narrowed. So there's not enough cushion in that knee anymore. As it progresses, it gets worse and worse. Now you guys, if you can appreciate that there's even less space in the knee. And this is the second phase of arthritis. And you can see how jagged the bones have become, which are known as bony spurs, which I'm sure you guys have heard before. So as it progresses and there's more degeneration, the knee looks less and less like a knee. And finally, it becomes the dreaded bone on bone. So this is when most doctors will tell you that you need surgery. So at this point, we could still utilize regenerative medicine to help that knee. We could have used it in any one of those phases. So another option prior to doing surgical intervention. And here's just a quick slide of our purpose. A couple of questions that you guys can ask yourself quietly. How long have you had it? How often do you get it? When is it worse? How bad is it? Have you become discouraged? A doctor's told you that you just have to live with it. It's your age, it's the weather, then nothing can be done.
Does the weather really
It does actually, it does, yeah. So the bottom line is that you're not just getting older. These conditions affect the young and the old just the same. It's not a product of time, but it can rob your quality of life and it can keep you in pain. And our purpose here is to help that. And we have several modalities to help that, and this is our newest addition. So we have another option to help clear this up for you guys. So when I was training in Birmingham, my mentor, Dr. Goodman, always used to tell his patients this. It's like, think about, I'm sure everybody here has owned the car, owns a car, correct? So think about the car that you've owned or own. Fast forward 15 years and you've had the car for 15 years. Along those 15 years, you're going to have done something to that car. You're going to have replaced something, you're going to have done some oil changes. Now compare that car to your body. Your body's the same way. There's going to be normal wear and tear as we use our bodies. Some people are more susceptible to more wear and tear depending on the activities that you do, and genetics has a lot to play with it also. So if you compare your car to your body, we're going to have to replace things in your body as well. And usually that's done with surgery. But now we can trial something else, and these are the stem cells. And this is the beauty behind stem cells, is that we don't need to jump to surgery. He always told his patients, he's like, if you could spend money on your body, on your car, then you can spend money on your body. which is right. If something goes wrong with your car, you guys are just gonna ignore it and let it be. It gets you from point A to point B, so you're gonna need it. Your body gets you from point A to point B, so you're gonna need it also. So don't be scared to take care of your body like you would your car. So what are your options? We can do nothing, which is always an option. And the fact is, you'll continue to suffer. Things might get worse, they may not, and you'll continue to have loss of function. We can do therapy or rehab, which is always the mainstay of treatment for most of spine or sports diseases. We can utilize medications, and these medications include steroids and other drugs. A lot of people are opposed to steroids, a lot of people are opposed to taking drugs, but still they're treatment options. Finally, there's surgery, which is the ultimate end goal of any type of treatment option. And even nowadays, surgeons are being trained less and less in surgery and more in minimally invasive procedures. So even the surgeon doesn't want to operate on you as they did before. So technology is being advanced in every specialty. And finally, a new option will be regenerative medicine utilizing stem cells. And there's 3 different procedures that we can use for stem cells. So here's just a quick cartoon kind of describing how medicine is usually done these days. We've exhausted all conventional measures. One last desperate option is to put you on alternative medicine that has a 96% success rate. So why try everything else when you can try the best thing first, right? So a little bit more about stem cells. So this is like the meat and potatoes behind stem cells. They're unspecialized or undifferentiated cells that have 2 characteristics. So that means that these are generally baby cells that can grow into any other type of cell. And it really depends on what the environment you put them in. So if you take that single cell and you put it in a tendon or ligament, it's going to grow into that tendon or ligament. If you're going to put it in an organ, let's just say the liver, it's going to grow into the liver. The nerve. And that's the beauty behind stem cells. And they're safe to use when doing them inside joints or spines. So there's different types of stem cells. You have bone marrow or adipose tissue stem cells. You have embryonic stem cells, which are illegal in the United States for obvious reasons. We don't want to mess around with any embryos. There's stem cells that can originate from amniotic fluid, which is a tissue graft taken from the placenta of a donor who is willing to help other people by donating the amniotic fluid. And that also contains a high percentage of stem cells. And it comes from the uterus of legally performed C-section childbirths. Nothing from Planned Parenthood. So there is a reality behind stem cells is as the younger you are, the higher volume of stem cells that you have. As we age, your stem cells age as well, and the number of stem cells also age. So this gives us some limitations when using them in regenerative medicine, but that's why we have 3 different options of where to use regenerative medicine or biologics, and I'll get to that a little bit later. And this is just a graph illustrating that newborns have tons of stem cells, and as we age, we have less and less stem cells. So just a little terminology if you guys ever do your own research. So stem cells are labeled either as pluripotent. So if you're getting stem cells from a younger population, then the pluripotent stem cell can become into any type of stem cell. If you're getting stem cells from an adult, they're called multipotent stem cells, and those are a little bit limited into the ability of what type of cell they can grow into. So it is generally better if you get stem cells done when you're younger. And again, depending on which type of stem cell we choose. And here are the 3 different types of stem cells. We have stem cells from bone marrow, we have platelet-rich plasma, and we have placental stem cells from amniotic tissue. So three different options. So the bone marrow aspirate stem cells, we actually aspirate it from your hip. and then it gets spun down, and then that gets injected into the affected joints, tendon, muscles. It's a procedure that can take anywhere between 15 to 25 minutes, relatively pain-free. There is a little pain associated when aspirating the bone marrow. Yes, a little. Surprisingly, from my experience, after the day of the procedure, completely back to normal. Not a big needle. Don't be scared. So platelet-rich plasma, another option that you have. So the process behind this is we actually use your own blood, similar to the bone marrow aspirate where we use your own bone marrow. So you collect blood, about 60 cc's, you spin it down in a centrifuge, and basically we extract the platelet-rich area, which contains all the regenerative properties, and that gets injected into the degenerative area of choice. Yes, they all form in, stem cells is an umbrella term, but they all can be considered biologic agents. Finally, we have amniotic stem cells, and those, like I mentioned before, are actually donated from pregnancy, and they're using amniotic fluid during the pregnancy. And those are bought, and they undergo rigorous standards to make sure that they were not tampered with. And then those get injected directly into the area of choice again.
There's no possibility of rejection?
No, and I'll get into that. And this is why. So FDA regulations for clinical use of stem cells, they can be changed, so they're minimally manipulated. They can't be grown or cultured, so we're not touching them, we're not letting them sit around. They're not in a petri dish. The treatment must be performed on the same day, and they're regulated like any other pharmaceutical drug. So very strict guidelines behind these. And what do they contain inside of them? So they contain two things, cytokines and growth factors. And these are the little worker bees that help repair and restore and help your body tell it that we want to regenerate this area. So the cytokines are like the foremen that tell the stem cells and the growth factors where to go, what to do, and what to become. And the treatments usually have high numbers of cytokines, and that's what's been studied and tested. You know, what growth factors, what cytokines are located in these samples. And the growth factors are what's needed for regeneration. So they have different types of things, enzymes, electrolytes, amino acids, that help repair and restore the area. So again, it's totally pure, there's nothing synthetic about it, there's nothing engineered. And here's just a little tidbit about safe processing for amniotic fluid and how it's extracted. So is stem cell therapy safe? I mean, you guys can tell me, we're using essentially either your own bone marrow, your own blood, or amniotic fluid. And as for amniotic fluid, it's not like blood, where blood has to be matched when you're getting a blood transfusion. So there's no antigens in there that cause an immune response. So there's no chance of rejection. And if you think about it, babies don't have immune systems, right? And this is what the babies are being bathed in.
So you're not using anybody else's stem cells? It's not donated stem cells? It's always...
The amniotic fluid is donated.
Oh, it is donated?
It is donated, yeah. So for PRP, again, it's achieved by using your own blood, and the bone marrow aspirate is retrieved from your own bone marrow. So really, how much safer can it be? So for regenerative / biologic medicine, it's safe, it's clean, it's effective. So there's nothing left to chance regarding your safety. And these are several conditions that can be treated with the procedure. The list can be a lot longer as well. But I'm sure if you guys look up there, you'll notice some things that you might have, or you might know somebody that has them, or your doctor has told you that you have. So all these conditions are amendable to the treatments. And here's another chart, a pilot study did by one of the companies that utilizes amniotic fluid, and it follows patients' pain scores over a 5-week period. And you could see by week 5, essentially their pain was down to a 0. So these procedures are simple. They take anywhere from 15 to 25 minutes, and you can get pain relief within 24 to 48 hours. After the procedure, you do not use any steroids or any anti-inflammatory medications like Advil or Aleve for about a 30-day period. And there's more guidelines for pre-post procedural care that we can discuss if you guys want a little bit later. So here's just a few famous athletes that are proponents of stem cells as well as non-athletes. And the running theme behind this is that they're all famous, they're all very wealthy. So that's who we're privileged enough to get it early on. And now it's become more acceptable and cheaper to do, so more and more people are doing it. And for example, Kobe Bryant is a professional NBA player. He just retired actually this year. His last game was a couple of weeks ago, or maybe a week ago. And he spent 20 years in the NBA, and he's been getting regenerative medicine done in Germany very early on when it was first very taboo to do regenerative medicine. So stem cells not only heal and repair, but they also improve overall function of the affected area, returning the patients to levels that far exceed their normal levels. And that's why these athletes were able to continue on. So I want you guys to think about it for a little bit, what your life could be like when you're no longer suffering. How it will change when you wake up every morning without pain. How happy your friends and family will be when you have your life back. And this is an opportunity that can be done by utilizing this stem cell therapy and this treatment option that we have. So you got to think about your self-worth, essentially. Are you guys worth the treatment? Think about that car analogy. You know, are you going to ignore that check engine light sign in your car? So you have two choices, one of which you never heard before. So you can think the same, do the same, get the same results, or regenerate with stem cells and start your life over again. And here's 4 reasons why you should do stem cells. Obviously, stem cells only work if you get them done, so you guys can think about it. But unless you actually trial it, you won't know if it's right for you. It gets worse over time. Like I mentioned earlier, stem cells, as we age, they also age with us. There's a better life out there when you're not in pain, so this is another treatment option that we can offer you. And again, there's nothing important more than your health. So really focus on your health. And that's my part is over. So thank you again, guys, for coming. I really appreciate it. Hopefully you guys learned something. I'm not going to be taking questions. What I'm going to do, I'm sorry.